here. All right. Good evening, everyone. Thank you for joining us at the Common Council Community Wellness Committee on May 16th, 2022. So we'll do a roll call. Councilmember Davies, I'm here. Councilmember Murphy, here. And Councilmember Falco.
Here.
All right. And so also joining us is I'm sorry, we moved right into the topic. So approval of minutes of April 4th and April 12th. Anybody had any concerns about the minutes?
No.
I think so. Good point. Okay. I don't think we have to formally vote on them, but we can certainly just approve them as they are. Thank you very much. All right, so we'll move into our topics now. And Dr. Friedel, thank you very much for coming this evening. So the Community Wellness Committee was put together by Mayor Drennan. So once he was appointed, he felt that there was a need to address community wellness, broadly speaking. There's a lot of different areas, certainly homelessness and poverty, and anything that kind of is encompassed by community wellness, which is quite a bit, especially also in the era of COVID that as well. So what we've been trying to do as a committee is try to understand a little bit more the impact of different situations on this community. We've been hearing a lot about our homeless situation. We know about some of the issues with mental health in this particular area, drug addiction. And so really interested in hearing from you some of your perspective, from your experience, and kind of helping us to shape our thinking. What we're looking to do is, as we begin to understand this, begin to look for places of intersection of things that we might be able to do as a city. We believe that we have some assets that are slightly at our fingertips in terms of grant. We have a really great staff here that can help us to write grants. The mayor in his role can also be an advocate for us at a county level or a state level when needed. So really trying to figure out how we as a city might be able to bring some of our weight to the situation, try to help it out. So certainly be really interested in hearing what you have to say. And Doctor, do you have anything else to add? Okay, great.
Okay, all right. Just take my mask off so you can hear me now. So I'm Dr. Ben Friedel. I've been in the community for 38 years now. I started my practice in Worcester in 1984 when I wrote the U.S. government 3 years at a time for a scholarship at med school. And then my wife and I came here and had our child, but we liked it here, so we stayed. 1997, I moved my practice down to the Foxcare Center for that. I was at the hospital board at the time, and we bought that from Betty Alls. We did, and everyone knows what it is today. It's a wonderful resource. So that's where my full-time practice is as a family doctor. I'm also the medical director at the nursing home here at Fox. So I'm mostly in geriatrics now. But about 15, 16 years ago, like many physicians in the community, I realized that we had a huge number of uninsured patients. At that time, this is pre-Affordable Care Act. It was estimated about 17% of the adult population of this county was uninsured. And I belong to the Unitarian Universalist Church, and someone happened to mention they were looking for a social justice project. And I said, well, free clinic would be really important. So the church took that, their social action committee took that on, but invited the public to be involved, and it became a community-wide thing. We formed a board, and in 2008, we opened our first office on Academy Street. A woman living there was a nurse midwife at the time. Remember her?
Maureen Sullivan, yeah.
Maureen Sullivan. We couldn't use the office, but it was perfect for us. So we had two exam rooms, and so we had community volunteers, physicians, nurse practitioners, physician assistants, all volunteering their time, as well as nurses and other lay volunteers who did office work. And at the time, again, pre-Affordable Care Act, we only opened Tuesday nights. All the volunteers, the physician, practitioner volunteers, were all, and still all, I believe, well, no, it's not now, but still, at the time, we're all full-time employees, either at Fox, at Bassett Hospital, or another hospital. So many of us were going to the clinic after our regular jobs were done. We were only open Tuesday nights, but we were seeing like 16 patients a night with 2 providers. The Affordable Care Act came along, and let me backtrack a minute. So when I approached both hospitals at the time, John Remillard at Fox and Bill Streck, the CEO at Bassett, both of them were very supportive of this, and they offered us free lab and x-ray services for our patients. The criteria for being served in the free clinic were you had to be over 18 years old. We didn't treat children at the time, still don't. Adults, and you had to not have any insurance at all and not be eligible for any insurance. But one of the things that both CEOs asked us at the time, and we've continued, is can you try and get these folks signed up for insurance? And we've done that. So we have screeners there now. We have for many years, we have screeners who screen the new patients to make sure they're not only income eligible, but they might be eligible for some kind of insurance. And after the Affordable Care Act was passed, as you know, in New York State, Medicaid was expanded. And many of the patients we started seeing after Affordable Care Act was passed in 2008 and since come in to see us, don't have insurance, but then it turns out they qualify. So our numbers, thankfully, have shrunk. I have to say, one of the things I said from the very, very beginning of this project was that I'd love to go out of business. You know, once everybody has adequate insurance, we wouldn't need to be in play anymore. But we recognized there was a coverage and a care gap. So that's why everybody who volunteers there. We are largely supported by donations and some grants. We don't apply for any federal or state grants. It's all either private grants or donated money from the community. And we've been very lucky. The community has been very generous. We currently, our clinic is based on in the building owned by Joan Fox and Barbara Roberts. They still in that building? I think so. Where the Social Security is housed in a real estate office and multiple other offices. They lease us a space there. We were able to remodel several years ago. We've been there ever since. We're really just open Tuesday nights, but we now have a part-time, two employees, both part-time, a volunteer coordinator and a clinical coordinator, both whom are Elaine Wood is our clinical coordinator, retired nurse from Fox Hospital, and Joan Rickard is our former worker at Fox, is our volunteer coordinator, both part-time. Work way more hours than we pay them, but they're both very dedicated to the clinic and what we do. So now we have one provider each Tuesday night. We see anywhere from, I'd say, 4 to 6 patients. They sort of, in my mind, fall into 3 buckets. One is people who don't have insurance, but we can get insurance for them. So we may see them once or twice and then they move on. And let me stop and just say, our care, well, I think it's very good, is very basic and not the best care anybody wants. We're open 1 night a week. We don't have an on-call service. The best you can do if you have a problem between Tuesdays is call and leave a message, and Elaine may call you back in a day or two. So it is not at all on par with what the rest of us have. Having an office we can go to, reach during the day, reach after hours if necessary. So this is strictly to fill this gap of uninsured people. But we have people who come and then, or between jobs, and as you know, most people here who are not on Medicare or Medicaid are have health insurance through their employer. So these folks come to us out there, maybe the work physical, go to work for a spring break or whoever, and then they pick up the thing. And then we have a group of sort of hardcore unemployed there, loggers. One guy the other day was a fireman who does. He was working out west as a fireman, and it was just a temporary gig, didn't have insurance through that. He's back here doing other things, contracting or whatever, and he didn't have any insurance. He probably won't have any in the near future. He makes too much money to be on Medicaid. So we have a group of people like that. And then we have a large number of Hispanic folks who either because of their documentation status or because of a lot of them work in the restaurant business where there is not as good insurance. So we have many nights we need a translator. I don't speak Spanish, but we have a group of volunteer translators who come, and they sort of make up the population of our patient group now, compared to pre-Affordable Care Act, where we had just a lot of patients. We had a high number of uninsured in the region, and that's where we were. We see patients from any county. The bulk of our patients come from Delaware and Otsego, but we have patients from Shenango, Schoharie, maybe even some from a few others far away. There aren't as many free clinics as there used to be because of the passage of the Affordable Care Act, so we do get some patients from further afield, but the majority come from those 2 counties, Delaware and Otsego. So maybe I'll stop there and answer questions. That's sort of who we are and what we do. We have a board of volunteers from the community who serve as our board, who raise the money, pay the rent. I'm the medical director, a volunteer unpaid position, and my job is just to consult with them, attend their board meetings, and consult with them about what's needed in the clinic that they might be able to raise funds for. We had a very generous donor who gave us money for dental care. We don't provide that, but we have a fund that if the patient comes in, we see them and realize they need dental care, we can refer them to we have a dental provider in the community who will see them at a reduced rate. They evaluate them, send us a treatment plan, we review it and see if we're able to fund that. And we also have a grant for mental health care that somebody gave us, and we're looking at how to fund that. I think it's going to be about basically paying for people to see a private therapist who perhaps not can't get in, but don't qualify for the services of a county mental health clinic or come from outside the county.
Have you been seeing an increase in folks with mental health challenges? Is that why that person went grant, or?
To some degree, there's always been patients who require mental health care either as exclusively from us or as part of their overall care. We prescribe medications, antidepressants, anti-anxiety medications, for example. We don't do complicated mental health prescribing because, as I say, we're staffed by family physicians, internal medicine physicians, and physician assistants and nurse practitioners, so we don't do that. But hard to say if there's been an increase. It's always been there, and I think that what the mental health care we're funding is for counseling, which we don't provide on site.
Ben, do you think,
Yeah, please, yes.
are there counselors in the community where you get these funds that would then be available to see?
Yes,
the folks?
actually Dr. Stan Fox, who's a local retired physician, is on our board, and he is the one who's made contact with 2 or 3 of these providers, I don't know their names offhand,
Great, okay.
who have agreed to see our patients as their clients for appropriate scale.
Great.
Yeah, we're just getting that started, but that's very promising. Yeah.
I know you said pre-ACA, but 17% of the folks in the area were uninsured. Do you know the percentage now?
I don't know offhand what it is. I know it's a lot lower.
A lot lower? Okay.
A lot lower. It's definitely lower. The ACA had a huge impact.
Okay.
And I could see it by our numbers.
Okay.
How they went down.
So just in doubling back to the mental health grant,
Yeah.
do you have that? Are you pursuing one? I'm just
We have a grant.
You do,
We
okay.
have a grant. I can't tell you how much, but there is a chunk of money we were granted to exclusively to provide fund mental health care in some way. And we felt the most appropriate way, rather than hiring someone, was to just make payments, as we do with the dental program,
Right.
to the provider who's agreed to see our clients.
Okay,
Yeah.
good, thank you. Other questions?
I do have one. I know you said all of your grants are private grants.
Mhm.
Are you folks eligible for municipal /
We're not.
Okay.
New York's an interesting state in many ways, as you guys know, but it's the same in healthcare. And there was talk about becoming a federally qualified health center, but there's so much regulation involved in that, way more than we were prepared to do. Where we really are a collection of practitioners who come to volunteer our services, essentially as an outreach of our practice. I say that because our malpractice coverage is provided by Bassett Healthcare. Those of us, I think all of us right now, work for Bassett Healthcare in some capacity. And the leadership at Bassett Healthcare, including Fox Households, has been generous enough not only to fund these the x-rays in the labs, but also to provide us with malpractice insurance. And we just have to simply notify the malpractice carrier that our work, as part of our work, we volunteer at this free clinic. And so we felt that was the best way to do it and not become a more organized clinic, which would require much more regulation.
Sure.
And Article 28 Diagnostic and Treatment Center requires a lot of inspections and all kinds of things. So we're sort of, in some ways, an offshoot of the Bassett Healthcare, but not an official not an official arm of it, more unofficial.
That makes a lot of sense. If you volunteer run, getting those things sounds like
Trying
a
to
lot
keep
of
it
work.
the
and a
least
lot of-
complicated as possible to
Exactly.
provide the care. And we offer vouchers. There's a lot of little things we do. We offer vouchers for patients who want to get a flu shot at a local pharmacy. Fortunately, the COVID vaccines, as you know, are free, so that hasn't been an issue. But the flu shots, we've been able to give them a voucher to go to one of the local pharmacies, I forget which one, and get a free flu shot. That's been a plus.
Doctor, one of the things that we're trying to look at and trying to identify are different gaps, in terms of support, wherever that might be. In your experience, in your knowledge, what are some of those gaps that you see out here within our area?
Well, I think a lot of perhaps some of this, there's a lot of gaps that are even folks with insurance can't access. Mental health care, not that we treat this, but especially among children, is a huge problem locally. And for reference, there was an article in the New York Times recently about this. And I know from our own pediatricians' experience, the pediatricians over the past several years are more and more treating behavioral health with medications, with significant medications. There are, I don't think there's any pediatric psychiatrists in the community, are there? And when they are, they're just swamped. So in this 3 or 4 county area, there's very little pediatric psychiatric support. So that's a major gap. We have certain specialty gaps. We're going to be facing a primary care gap. I'm not a youngster. There's a lot of physicians in my age group who will be retiring in the next few years. So recruiting primary care practitioners to this area is a huge challenge. Pasadena Healthcare has been finding different ways to do that, to get primary care practitioners to come here. One of the best ways is to recruit people when they're in high school, believe it or not, to find a way to, if they want to go to medical school, to help support that, maybe financially, with the obligation of time to return to the community. And many communities around the country have done that, because if one of the best markers of success, this has been studied for a primary care physician especially, to stay in a community, is if they grew up in a small town. And they know what that small town's like. It's hard to get people who grew up in a city to come to this community. Now, I grew up outside of Boston, so this was a venture for me, but it's what I've discovered as a practitioner here, and what I try to sell to the physicians that I recruit, is it's a great place to live, and to grow up, and to raise kids, safe in many ways. It's a safe, clean community, and that's the selling point. But somebody who grew up in that kind of community understands that already when they come here. So finding primary care is going to be a challenge in the next few years.
So you talked about kind of recruiting in high school. Is that something that would be behind the New Visions program of BOCES?
New Visions is the start, but I would suggest maybe and this may be something to work in conjunction with Pasadena Healthcare, since they're the major provider of healthcare in the community, is how can we target some of those students, especially if they get accepted to medical school, and say, listen, you're out of medical school. And let me stop and parenthetically add that medical school is extremely expensive. It's not unusual for us when we're recruiting a graduating resident in any specialty, especially in family practice, that they owe $200,000. So, and that, unfortunately, I think I'm pretty sure I know, influences their choice of what to specialize in. Because unfortunately, ophthalmologists, orthopedists, plastic surgeons, radiologists get paid more than I do. Not that I'm underpaid, don't get me wrong. But when they're looking at it, not only live a life, but pay back $200,000, they might be choosing ophthalmology and not choosing primary care. So if there was a way for us to say to those students, hey, would you be willing to come back to this community? It doesn't have to be only out of city maybe, but somewhere in the region, in the community area, we'll support you, we'll give you money. That's essentially how I ended up here on a federal program that really is much less. The military has a program the same way. So that might be a creative way to see how can we get people to come back here. And it could apply to physician assistants and nurse practitioners as well, as physicians.
Well, this is an aside, but in my day job, I've been working with law school districts trying to figure out the same problem. How do we get educators, teachers, administrators to stay in this area? And we're trying to work on those pipelines as well. How do you start them in high school thinking about education or whatever it might be, go through their college where they might go, come back and remain in this area. So I think these are the same types of thinking that we'll do through. It's absolutely so essential for us. Any other gaps? I just didn't want, like I cut you off.
No, that's as much as I can just do off the top of my head.
And thank you for that, Greg.
Sure.
What a dumb man.
No, I'm absorbing a lot. I appreciate it.
I was kind of curious, you know, I think it's wonderful, a free clinic, but as you're saying, it's limited hours. What if someone is uninsured and they have a medical emergency, they go to
They
the
end up in
hospital?
the ER. One of the things that, I don't know how well publicized it is, but Bassett Healthcare, and I think all hospitals in the country, at least the not-for-profits, have to have a system whereby if somebody comes in and is seen in the emergency room, has bills, if they can apply for, I forget the program, it's the community something program that Bassett has for funding these things. You have to be under a certain percentage, I believe it's 300% of poverty, your annual income, and you can qualify for this, and they'll either write off or pay the bills. But no, there's really no other opportunity only but to just go to the ER and be seen there.
Yeah.
And it's, which, as you know, is the most expensive care around.
It is, you know, and I mean, just like, you know, because I also know that many people don't go to the ER for that reason.
Exactly.
Even if they need to,
Oh,
you
yeah.
know, so.
No, that's been very well studied in the underinsured underinsured population, is that it just costs too much to go. Even now, as many of us perhaps many of us know, insured people maybe have a $250 copay to go to just to walk in the ER. So that really makes you think twice about going, which, you know, is a financial disincentive. But if you're having belly pain and you don't know you have appendicitis, you don't want to be looking.
Yeah.
Yeah, there's no good,
Yeah.
real good after-hour system for that.
Dr. B, can you give me a little bit more of an insight into the process where someone is being screened for their eligibility and a determination is made that they in fact might be eligible for insurance, they just haven't gone through the route that they need to take to get there, what that looks like, and is there some educational process that then happens as well for them in terms of letting them then know what their options are in terms of their own?
Right, what happens is that our clinic is only by appointment only. So people will call and they often get an answering machine, but someone usually calls them back within 24, 48 hours. And as a new patient, we ask them to bring in their financial information, tax return, pay stubs, things like that. And if they then meet the criteria for eligibility to be seen in the clinic, and if anything, I have to say, we'll err on the side of seen, if there's any side of certainty. We then make the appointment. When they come in, they usually are first seen by a screener. I think these are past employees who volunteer for us. I'm not sure of that. But these are folks who are knowledgeable in what insurance options are out there. So sometimes that very night, they're able to be told, hey, you know what? You qualify for Medicaid. We're going to put in your application and help you fill it out and get it in. And then they're educated what their options are. Some might be eligible for Medicare or not. It's less common because Medicare knows who you are and knows your date of birth and sends you something. But they're assisted with the application process, and most of them, I think, it's going through the expanded Medicaid program.
Does Bassett, I mean, God bless you guys all for doing what you do. Just, I'm wondering if Bassett incentivizes the large number of staff that are part of the system to volunteer. You know, I don't know that there's a lot of other clinics like yours, and so you might be one-stop shopping for folks that are inclined to volunteer.
No, there's nothing that Bassett certainly supports us. And certainly when I put out occasional calls for volunteers, Bassett has said, look, if you want to use the email list for the Bassett primary care providers, go right ahead. They've been nothing but supportive through this whole thing, even with the change in leadership. Dr. Abraham is very supportive of what we do, as were the leaders before him. But they don't incentivize us really in any way, but they certainly are in support of what we do.
So have you seen any trends in the Hispanic and undocumented population? I'm curious about them, and also thinking about, you know, what about the children?
Yeah. Yeah, we decided, for a couple of reasons, we decided early on not to see children, just because that meant the internal medicine folks who volunteer with us couldn't see them. But also at the time, even pre-Affordable Care Act, children seem to have a better and a better insurance, uninsured kids had a better chance of getting insurance. So I can't really speak to the children. I don't think there's been, I think the uptick in the Hispanic population more reflects just the presence of more Hispanic folks in the community more than anything else. And the fact, as I said earlier, I think they tend to work in businesses that don't typically offer insurance, like restaurants, landscaping, construction, things like that.
Yeah.
Yeah.
And you mentioned, just on that point, you mentioned about having volunteers to translate. Do you have enough volunteers for that?
We do. We're very lucky. We have 2 or 3 volunteers that are on sort of on call. In fact, the schedulers are very good. If they know someone's coming in who does not speak good enough English, they will, ahead of time, they'll reach out to one of our handful of volunteers. We have a professor from Harwick and someone else who worked at SUCO, and physician, retired physician. So we've got people who speak Spanish who are happy. And we often can just get them on the phone. It's a nice thing. They don't have to be present in the room. We can just get them on the phone and they can talk. We're on speaker to both me and the patient. Works out pretty well. Because in general, with translation, the general rule is you try very hard to not have a family member be doing the translation. There's too much nuances there.
Right.
You really want an unbiased person who's not connected to be doing just straight translation.
Right, okay.
Yeah.
Any other questions for the doctor? Well, first of all, I just want to say thanks for coming tonight. It's really been helpful to hear from you. And more than that, thanks. Thank you for all that you're doing with that center. I mean, I've frankly heard about this for a while, and I just think you're doing some amazing things. It's really neat that we have that resource here that's built on the back of volunteer work. So I think sometimes volunteers don't get a lot of recognition for what they do, and thank you for that, and to all the folks involved.
I appreciate that. And I'll pass on that thanks to our board and our volunteers, because I know they'd like to hear that the city is interested and has heard from us and is very interested in working with us. So.
Absolutely, and if there's ways that we might be able to work together, please don't hesitate to reach out.
I will keep that in mind. Don't
Sounds
worry.
good. All right, well, thank you very much, Doctor.
You're welcome.
Thank you.
Nice to see you all. Thanks for having me.
Thank you so much.
Oh, you're welcome, man. My pleasure. Nice to see you.
You too.
Have you seen my family?
Um,
Do you follow them with Facebook?
I'm not.
This is how old I am. I haven't went to school with my boys. Probably, we recently had a wedding. And they got married, both got married. They both I had a daughter-in-law. There they are. That's a better picture.
I love it.
There's one daughter-in-law, two daughters-in-law.
Oh, yes, and more Allison.
You met Allison.
Yeah,
All
no,
right.
she's wonderful.
Good night, everybody.
She's
Thanks.
lovely. All right, say hi to everybody.
We'll do it.
Okay, thanks.
All right.
And that's what we love about a small town.
Yeah.
For me, I mean, just a quick kind of debrief of that. The 2 gaps you talked about were real takeaways. We've heard, I think, from our chiefs about kind of mental health, and we heard that from Dr. Manning the last time about the mental health among children, behavioral health issues, and that's a problem. So it's a recurring theme that we're seeing. They need to think about that. And then the whole issue we're dealing with, how they're having an issue with recruiting physicians to this area, and we know that we're having a problem with recruiting other people, and that's again something I think we need to think. We need to have a more systematic approach to that, housing being a big part of that, but then also how do we begin recruiting folks and creating pipelines and opportunities. So maybe some questions that we can, as a council, begin to, these kind of issues that are kind of crossing across many of our particular communities.
So the solution is a holistic solution. There isn't any way to
Right.
solve this one thing without
Exactly.
the whole thing has to get
Which is frustrating. We love that silver bullet, but we don't have it. So I'm going to move to correspondence. I felt like this was worthy of bringing up, and Chief Wissenberg, I know you were involved in these kind of emails and everything else, but just wanted to. Someone had sent us, or sent the mayor, I guess, and then it got to me, and just bring it up. It was concern about busloads of homeless people being dropped off in Moniana. They're seeing a huge increase in the food pantry. So that was kind of one concern. The other was being told that 50 refugee families were being brought to Moniana to live. So I think the first one, or the second one, if you will, seems to be getting out a little ahead of something. I know that there's be discussion about that, but it's not necessarily action right now, and we're probably pretty far away from action. But the first one is this kind of, I guess I heard it as a reoccurring myth, and I think that, Chief Wittenberg, not being on the spot, but I think you kind of said there's no, you don't have any evidence that this is taking place, that we have these kind of buses showing up. I think you, in one of the last meetings, talked about how the fact that it's just people find us here and come here. But it seems like this kind of myth of the big buses coming up to Oneonta with, 20 people on board, where it might be, seems to permeate within the community. So just want to put that out there.
Yeah, I really have nothing other than what it is that I read in the email to indicate that that's the case. I would think that with the network of officers that I have in the public, as well as our connections within the community, I mean, we're talking thousands and thousands of people that we can reach out to at any time that call us with concerns. A lot of times we end up hearing about this stuff in advance. This is the first I've heard of it. So I can't speak to the validity of it. Clearly we've had an increase in the homeless population, but that's a national issue, and there's over 60,000 people currently residing in shelters in New York City. So where it is that we can turn that from anecdotal into some sort of testimonial evidence to be able to say this is in fact occurring, I don't know. I know that in past years there's been a migration out of the bigger cities for people, whether it be for more ease of resource or just the dollar goes further in an area like Oneonta. I'm sure there's been some increase. How they've gotten here, or if it's a systematic thing, I can't say. I just don't know.
Yeah.
But no, I'm just thinking. I agree. I think again, Chief's the expert on this, but I feel like, and not to dismiss this person's concerns, but I feel like the police department, and as a result, we would probably know about this.
So the concern for me, Mark is right, there's always the stories, and people want to create their own narratives, based on whatever their perceptions may be. But the concern for me was that the individual that brought this forward was recounting essentially what was told to her, I believe her, by what she felt were well-placed individuals within the city. And I'm presuming that no one has stepped forward to speak with you about that. It's a concern to me that certainly we know that the second piece of that equation is not tethered to any kind of reality, the refugee concern. And the concern about buses is something that we hear often, and there may be some kernel of truth to the idea, and that anybody could get on a bus from a metropolitan area and come join our neighbors here. But my concern is that if there's somebody within, and I guess she said that there were two individuals, I think that's the way I read it, a couple of individuals that were putting out what seemed to be fact-based opinions because of their involvement with the city government. Then in some fashion, we need to kind of let folks know that if it's not so, and you're representing the city, don't say it's so.
Yeah, and I think in that email was,
bring it to the police chief.
the claim was a higher level of government outside of the city. So it wasn't
Outside of the city, did I misread that then?
like a county or a state employee.
Well,
Government
that's a
officials.
significant relief to me then. I thought it was an internal to the
No.
city concern, and I've been.
And I agree with you, Mayor, that oftentimes what happens is people have a tendency to fill in the blanks on things they don't have all the information for, and come up with logical explanations. Now, not to say that's not a logical explanation. I know that there's social service groups, hospitals, NGOs that'll pay for bus transportation for people if they say that they want to go to a particular place. It could be that, you know, there's been people that have been given bus tickets here from other areas. That I don't know, I don't have evidence that that's happened, but as far as like a systematic influx of homeless people in Tony-Anta for some reason or another, I have no information on that whatsoever.
Well, I'm relieved to know, I'm relieved to be corrected that it's not internal to the city of Oneonta.
No, that would be a much more concerning issue to me.
That's where I was, so that's a relief to me there. Still concerning, but a little less so.
Yeah, I think anybody within the city, had they had this information, would have come forward to somebody in city government.
One would think that's
prior, I would
what
hope.
they had.
Well, I think, and Chief, I appreciate your responses now and the email chain, and I think that we just need to be consistent and let people know that is not the case. There's no evidence to suggest that is the case at this particular time. As you suggested, homelessness has increased across the United States, and I'm sure we're no different here in this particular area. But it just seems like this kind of pervasive, they're bringing them up here. The city government is seeing this as, it begins to undermine the, kind of approach that we're trying to take, is trying to figure out how we kind of support the folks that are here, and we're certainly not trying to open up the floodgates for more folks to come and support the folks that we have here.
There's the potential of taking our narrative that we're working on, diligently to let people know that we are taking these issues seriously and that we're inviting them, as we just did with Dr. Friedel, to be a part of the solution. It runs counter to that narrative, and it's not helpful. But we'll be diligent.
Yeah. All right, well, I just figured I'd bring that up. I know it was concerning to me to read all of that, but I appreciated the chief's response. So we'll keep on trying to get the word out to folks that there is that we don't have 50 families arriving soon.
This is just my personal opinion, but I would like to think, I don't know what would motivate someone about why they would be concerned about us supporting refugees coming to this community. And I think especially in light of me reading about this great replacement theory that's motivating some people to be racist, I think that as a city, I would love to see us really support, the efforts to bring refugees here.
And we are.
And I know we are, but I think we should be out there about doing that and not reassure people, oh no, we're not going to. I just feel like that message is really important, and I know you are, and we are, but.
I need to apologize. I don't think what I meant to say came across. What I think we're trying to do is a very thoughtful way to make sure that we are providing the services and what we need to do to be able to have folks come here. So it's a thoughtful approach to it. It's not that, we have 50 people descending, tomorrow, and we're not ready to support them with all the different level of services that we would need to have to support these folks. I think that's what I meant to say, is that we're kind of taking a thoughtful approach.
Right, and I think that's probably where most people's concerns are. They see that there already are housing issues and different, there's, different support issues for people already that even live here, and they probably just feel concerned about bringing more people in that need support, And so I think, I always think education is just like the best answer, just becoming more informed and educating people about what the process is to alleviate those kind of concerns.
The priority is that as refugees do come in, and they will come in because we're a welcoming city, and so we're going to do everything we can to be supportive. But the key is that they are, as they join our neighbors here, that they're going to be successful. And
Right.
so there's a lot that we need to do. Housing is part of it. There's all kinds of support, and there's all kinds of systematic, checklists, essentially, and people that are going to be in place to provide that support and services to ensure that they'll be successful before they're brought in. And all of those things are going to happen before we do bring folks in. We will, however, be bringing folks here.
Yeah, and I think that's great.
if I may just add something quickly. I'm not sure if the folks, the government officials that did come forward and say this, watch this. If there is a legitimate concern about this, please do come to our police department or us, so we can get the facts straight. I think, Diane, I think you are very correct in, there is a lot of energy in the air. It's best not to spread misinformation around it, because as we saw, we've had lots of people die in the past week from it. So I think you're absolutely right.
And I would also add, I just got confirmation from Dan from OFO, who, you know, runs the homeless shelter. They've seen no evidence of busloads of people coming into town.
Yeah, I haven't, you know, with my connections with Department of Social Services and the other services, it's never been mentioned that we've had, you know, a drastic uptick in people seeking housing and otherwise. So again, I just don't see where this would have come in.
All right. Thank you for bringing
Yeah,
it up, Mark.
yeah, thank you, and thanks for the discussion on it. Great, so let's move to Councilmember Falco. You want to talk about the walkway between Main Street and the Frontage?
Yeah, so we had a meeting last Wednesday with downtown constituents, just kind of talking about the upcoming street closures and different things that they wanted to bring up. And one kind of topic that was discussed is our downtown and how there are some individuals that like to loiter in Muller Plaza and the walkway, you know, in between. It's kind of been an ongoing concern for people. And there was a suggestion made if the donation box that's in there with the clothing could perhaps be moved to a different location. Also, there was someone recommended, I think there's some electrical outlets in there, maybe capping those just to kind of encourage people to use it as a walkway and not a place to hang out. So I thought I would bring that up to the committee.
Yeah, I can just tell you, it'll be about a 6-week issue before the construction starts on Springbrook.
The Ford building here.
Right.
But
Oh,
I'm
okay.
gonna redo that.
for what it's
one.
worth, just to give you a
Right.
time frame.
Oh, okay.
And they actively own the building at this point, right? They do own the whole premises and everything else. So
We're,
capping,
we're just figuring out the last bit, but
Right.
yes.
capping electricity and things like that would have to fall to them. We don't
At
have
that
access to.
point, well, there's a,
Okay, well, I wasn't aware of that timeline.
no, that's
You
a
know,
reason
so,
I'm going
okay.
out. But the box for clothing and so forth and the.
It was more of a-
That's more of a winter.
It's more of a winter thing, but it's just something that I think was brought up that I, you know, it's my job to bring it up to you.
And the chief, when we did have, you know, it really kind of got to a place several months ago where it needed some, you know, some active mitigation, and you guys, you were there, you know, regularly, and the police presence makes a difference.
It definitely does, and I know that it's very much appreciated by downtown business owners. And Main Street.
I'm glad to hear that. We're still working on trying to get some more exposure downtown. The mayor and I spoke about this a couple of weeks ago when we met. You know, it's a tough issue for us because we have a lot of people that are involved with us frequently. And there's not a lot we can do to mitigate that except through the courts. And the courts move slowly, and we have issues there as well, post-pandemic and turnover and staffing. We've had some hiccups, so we're working on that. Those are things that we have an eye towards trying to fix, but I don't think there's any near-term solution.
I'm curious about, has Oneonta ever had or considered some kind of loitering law or?
We have one on the books.
We have one on the books.
process?
Yes, so for the purposes of like begging for money, that's a solicitation. We have a no solicitations code that we can enforce as an ordinance. But again, these are non-criminal offenses that require us to issue an appearance ticket, and we really can't do anything except for push people along, issue their ticket, and, you know, send them on their way and hope that they're not back 5 minutes later.
Yeah.
Again, we may end up with 15 of those before we get any real resolution. So it's created a lot more work on the front end for us, with some acceptable resolutions coming forward through the courts, but it takes time.
Yeah, okay. This is a little bit different, but while I have you, I'm also curious with that note about kind of like noise at night. So as someone who lives right on Main Street, it's extremely loud, you know, at late hours in the morning, especially. I don't want to blame it completely on bars closing, but it does kind of tend to happen around that time. Like at intermittent periods, there are hordes of people that are screaming down Main Street. Do we have any kind of way to work, tamper that down a little bit? Or can, you know, is there any kind of noise ordinance in Oneonta that citations could be issued, you know, for?
There is a very complicated issue that we can talk about at length after the meeting if you'd like. We can give you some insight into that.
Yeah, I'd love to hear it,
Yeah.
you know. I just in thinking, you know, like if our overall mission is we want people to move here, we want people to, you know, if they're staying, there's an Airbnb that's opening up on Main Street. If someone comes here as a visitor and they're awoken in the middle of the night by people screaming and throwing things, and it sounds like someone's being like murdered outside, you know, they might not be like, oh, I really want to move, you know. You know, it just in general, just kind of. But yes, we can talk more about it after the meeting. So.
It's good that it's not 20 years ago.
I mean, I can't, you know, I don't know what to say to that, 'cause.
Yeah, we had some significant issues years ago. Even the last 10 years, it's gotten significantly better. There was a period of time where I think 60% of the downtown businesses were vacant, and we were having between 3 and 4 broken windows a weekend. And some of those plate glass windows are running in the thousands, several $1,000s to repair a plate glass window, so.
Not to mention they're just really dangerous.
Yeah, well, we had some significant injuries from them as well.
Yeah, I'm sure.
Yeah.
Okay, yeah.
Yeah, I'd be happy to talk to you after the meeting.
Okay, thanks.
All right, well, changing directions, Councilmember Murphy, you had updates on the survey.
I do, and I want to apologize to our chiefs and our clerk. I sent a zip file out, and I couldn't keep it open after trying that, so. I sent out to Carrie, and whoever else I CC'd, I can't remember. We got 6 responses back from some community partners, and in my haste, because I thought I could open that email, I didn't print it out, but I do have it here. That survey that we did, we have 6 community partners that responded. Periodically, every couple of weeks, I'll send out another reminder to get a nudge. I know everybody's busy. This will come to no surprise to anybody, but I think without exception, homelessness and housing are some of the biggest issues we see here. Even if it's not directly homelessness or housing, the rates of domestic violence increasing because of homelessness. I think you even talked about that a few months ago. We've had Catholic Charities respond, Opportunities for Otsego, SUNY Oneonta, and I apologize if I didn't get to Chiefs in time. Carrie, would you mind forwarding the survey results to them? Or to everybody, actually, because I can't remember who I CC'd on that. So, you know, it's not a lot of new information. It is nice to see that, if you can even say that word, but a lot of the problems you folks are seeing, other people are seeing, it's not like we're missing much, if anything. I haven't really seen anything on here that raised my eyes, like, why haven't we talked about this? It's definitely consistent with what everything we talked about. So it's nice in the fact there's no big surprises. It's things that we're actively trying to work on. There is a lot of folks I really appreciate again, whoever watches this, to the folks that took the time to fill out the survey. Some of the responses are fairly lengthy, which is great. So I would encourage you folks, if you're interested, or when you get a laptop, it's not the easiest thing. I did a Google Forms and it saves the information in an Excel spreadsheet. So it's opening the cells on a phone is a little difficult. But it's good information, and it really is confirming a lot of what we've all seen or have been told about.
Maybe what we can do, Luke, is kind of decide a cutoff date and
Yep.
let everybody know, and then cut it off, and we can pull all this out and kind of assemble it and be able to get it out to everybody and pretty accessible, at least in advance of the Community Wellness Summit. But have everyone time to review it and to think about it. And I agree. I think we have a pretty good feel of what's going on. Certainly, Chiefs, thank you for all that as well, and Doctor, for your insights. But it would be helpful to maybe have all that information in advance.
Yep.
I mean, it just basically, I think it speaks to the problem we have, and then we can begin to identify some of those gaps that we need to address as well, and maybe we can kind of frame some of the summit around those problems, and the gaps, and begin to have that. But for a different, I think there's a lot of time between now and August. We need to do some thinking about how to be able to set the summit up.
And I would just also quickly again like to apologize. I thought I had it nice and formatted, and it came in a zip file, so it was kind of a last second.
No worries.
Set it out, so I'll try to clean it up and get it out.
Luke, can I ask, how many folks did you contact? I actually didn't have any problem opening your zip file, so
Oh,
I
really?
read
Okay.
that earlier.
Okay.
But you had those 6 responses. How many folks did you work on?
I believe 25 to 30.
If you want to share that list with me,
Sure.
those folks that didn't respond, maybe I can exert a little bit of additional pressure.
Yeah, it's been folks that we've talked to in committee, as well as Chief. The email list was very useful for the Community Solutions panel. I sent a lot to the folks on the panel, so it's been very helpful.
It was pretty wide ranging. There wasn't a lot of overlap, so it was really individuals from a bunch of different organizations. So certainly getting a little more understanding would be good.
Yeah, so if I can help, I mean,
Yeah, sure,
obviously,
sure.
the more voices that you hear from, the more likely you find some
Yeah.
consensus that's.
Yes, when I get my laptop, I'll send you the email, Mary. Thank you.
Ken, if you could let me know also if there's panel people that could be of assistance to try
Sure.
to, I can maybe just remind them at the next meeting, which is Thursday.
Yeah, that'd be great, thank you.
All right, and moving on to the Community Wellness Summit. Luke, I know you've been in conversation with someone who might be able to facilitate that.
Yes, yeah, so through my contacts at the graduate program, we did a lot of work with facilitation. I was recommended to Leanne Hirabayashi, who is an employee of Bassett. She used to work for OFO and is in the, can't remember my hand right here. Well, she used to work with the housing department at OFO, but she's also a trained facilitator for events like this. I spoke to her. She sounded very interesting. She was very interesting. Very interested. Sorry. Sounded very interested in what we were doing and what we're proposing, and she even proposed a model of facilitation called System in a Room. She said that it's very powerful. It is pretty comprehensive. Sounds like a lot of what we had envisioned, but this is the actual name behind it. And it's usually a day and a half to a day to 2 days. There's some flexibility, but it's usually at the very least a full day process. She said she's had a lot of success with it in the past. It can be very powerful, and it really gets people, she said, she's seen to continue the conversation beyond the summit itself or the conference itself. She said that she usually does it with a partner that she works with, and she'd be more than happy to talk with us in person if we'd like to reach out to her maybe for our next meeting, but I didn't want to invite her without speaking to the committee first.
Great.
Great, yeah, awesome.
What's her name again, Laura? Her-
Lynn Hirabayashi, Hirabayashi.
Got it.
I'm just gonna ask the obvious.
No, go ahead.
About what I'm thinking, might any discussion of payment, I mean, is this something that she would be doing out of the goodness of her heart and volunteering, or is this something that she would be expected to be paid for this, or?
You know, it's a good question, one I didn't ask. I was, I apologize.
No, that's right, I was just, it just kind of occurred to me now, like, goodness, well, I hadn't thought about that part of it, so.
Me neither.
It's not a pay a person, so, figure that one out, so. All right, well, I guess we will, we'll keep on kind of working on this. What I'm gonna suggest is, maybe at our next meeting, we start, kind of devoting, so we'll have the survey done.
Hmm?
Mhm.
We can devote more time to really beginning to kind of tease out what this one's gonna be like, participants, and things like that. I don't know if we wanna do that in here in committee, or if it's something we wanna do kind of through email, but I think we need to begin kind of moving along or thinking about this and beginning the planning. And maybe you can loop back to her and see if there's a fee that she charges for that typically, so that we're able to, understand what that might be, and then think creatively of what we have to do, and kind of go from there. But I think we need to definitely, I mean, the summer's gonna go quickly, I should
It is.
say.
It is, yeah.
2.5 months
Mhm.
away almost from where we might wanna have this summit, so I think we need to think about that a little bit more. Anything
Maybe-
else?
What, we were thinking first or second week of August?
Yes.
Yeah. Okay.
And I need to nail down a time with SUNY Oneonta and see that they will be able to provide us with the,
It would probably be for a full day or a half day. I mean, I guess how long,
It sounds like, I mean, I'm sure there are
Would she-
other methods.
Mhm.
This is one that we talked about on the phone that she said is particularly successful. I will, when I get home tonight, email her and CC both of you on it.
Okay.
And she can, so we can have a more direct line of communication. Because I'm not entirely sure, I'm sure there is, but that was kind of the one we discussed. We talked for about 20 minutes.
I just know when I worked at Grinnell, like sometimes I would help to organize like different summits or symposia, and like it could be like a half a day or it could be like 3 weeks. You know,
Right.
like it can, which I don't expect that it would go that long, kind of thing.
No, I don't think 3 days was not much.
Yeah.
Yeah, so on a different but related topic, so when we're looking at COVID, one of the real helpful indicators has been wastewater checking to see, it's a predictor. And I wonder if we have, within the context of city government, DPW, police department, a way to begin to determine some benchmarks for our drug use in the city. DPW is cleaning the streets in the morning, and are they gathering more or less drug materials than they were? What's our trend line looking? What's the police department looking at in terms of their interdiction of drugs and drug use in the city? It's a mental health issue, and addiction is a mental health issue as much as a safety issue and beyond that. I just wonder whether or not we might be able to determine some benchmarks based on some of the things that we just do here. Asking. I don't know if anybody ever asked DPW anecdotally to hear sometimes about having to clean up syringes and this and that in the planters and so forth. But if there's a way to kind of track our trends, I'm wondering if that doesn't maybe help this committee in terms of knowing whether or not we have an escalating issue or an issue that may be diminishing.
Well, couldn't you track, you probably do track calls for overdoses and
You
ER
do.
visits, could you
But there's some
track?
complications with that too, because now Narcan's become so widely accessible. So people are overdosing, either self-administering or having somebody else administer Narcan for them, and refusing transport or not calling the hospital. So there's a lot of forces at play between recent reforms and our ability to perform street-side searches, for instance, has been significantly diminished. So with all of those changes, it's been exceptionally difficult not only for us to take aggressive enforcement action, but to see prosecutions through, as well as detect problems as they arise, other than if, let's say, we get a bad batch of, say, fentanyl or something that happens to come through, we may end up with some people that need to be transported that they couldn't, self-administer Narcan or, but overdoses as a whole, I think, are down when they're reported. That doesn't mean that they're down across the board. And I think, our partners at the hospital would probably have a much better idea as to whether or not, what they're seeing as far as trends go, because they're getting, other things, whether it be infections or, other effects from substance abuse issues.
Yeah, again, so I'm looking at more like a wastewater kind of a thing, where you're looking at maybe a little bit of information here and a little bit of information there. It's not exactly everything that you want, but that particular keyhole of information is repeated month to month, and then you can even start to see within that limited context of the reporting there a trend line. You look at whether or not you're seeing more or fewer leftover drug materials being scooped up at 5 o'clock in the morning. That maybe provides a trend line. Maybe a number of these squatters that are being, rousted from, buildings, as a trend line. All of these things, uniquely probably, aren't all that valuable, but maybe like wastewater, the cumulative, reporting of those things, if we start to think about, if you guys start to think about, what do we have that we can, access in terms of.
I think the problem that you would find there is that it would require very specific chemical analysis of wastewater, and you're gonna find that to be.
Yeah, no, I'm not suggesting
highly-
wastewater, but as an
Like
example.
municipal waste kind of thing,
Yeah.
yeah.
I would have to agree, I think partnering with Fox Hospital would be the best approach through a quality improvement program, through our department. We can statistically look at, we went for this specific call, and if we have an avenue where we can follow up with Fox Hospital, and they can say, all right, so you had this many numbers, and this number of people tested positive for heroin, this number tested for meth, we can know kind of where we're trending.
And then, I'm looking at, look, I tasked you guys with, a huge ask here. And it's very difficult for you to know whether or not you're just, treading water. Or if, right now you've been in essentially strategizing, meeting, gathering information mode. But at one point or another, you're gonna wanna know whether or not the efforts that you put in and the people that you brought in to work as partners is having effect, right? So, food insecurity, are we seeing more, more people, or fewer people accessing our, our various services around that? All of these various things, I wonder whether or not, I didn't mean specifically that we would test wastewater, but I'm looking at, this idea of collecting a lot of information that's just almost particulate, and that because it repeats on a monthly basis, you start to see trend lines. If that might not wind up being something that in, a year's time, you say, well, we've really made some progress because you can see the effect of your work here. And I feel like I want to give you guys an opportunity
Right.
to celebrate success.
I'm sorry not to interrupt, but I wonder if, I feel like maybe as part of this summit, that could be, you know, a really
I
good
just
thing
wanted
to
to put it out there
implement.
as
I
a
think that's
thought.
really a great point, you know, in that if we are getting all of these organizations together, how can they help us to, you know, how can we together come up with a system for gathering different types of information so that the city can look at those trends as a whole?
Well, and if I could, I guess I have two responses. So one, it seems as though we need to identify what metrics we're gonna use. And I think it needs to be across the board, right? I think we shouldn't be focusing just on drug usage, there's all these things, right? So it seems like identifying where we're gonna get that data and then getting it regularly. And I don't know that we're gonna see a whole lot monthly, maybe this is an annual collection of data that can inform many different groups, whether or not this committee or others should play that role. I think that can be, you know, maybe that's part of the summit, is to say, how do we kind of pull together our resources? Some groups do a piece of this, how do we pull it together? But to address your kind of wanting to have a win in the numbers, I'm gonna be really honest and really frank. I've already accepted that I'm not gonna see the win in the time here. And it's not because of the fact that we're not gonna do anything, it's because this is a big pervasive issue. And people have been working on this for a long time, so we're not gonna see a win. What I think a win is, or what I'm gonna define a win is more organization, that we can kind of get groups kind of working, maybe ways to identify the gaps. Again, the mental health among children keeps popping up. That to me seems like if we could get some traction on that someplace, that's a win. So it's smaller wins, I guess is what I'm, probably be a pretty big win, but I think understanding the gaps and understanding the holes, beginning to have a plan to address them, to me, the structural issues is a win, even if it's not having the outcomes yet, we're not seeing the impact on that yet. So I guess I would say is that we can certainly put some time thinking about where those measurements might be and who might have them, and maybe we get to come up with a process for pulling it all together. But I'm gonna count wins a little differently, and no offense, but I'm just
Not at all,
saying,
not at all.
right, just, this is, a lot of people have done a lot of great work on this for many, many years, and yet we know that it's still an issue in this community. So I think we're all just gonna have to put our head down and continue to work at it and take the victories when we can, the small victories when we can.
Yeah.
Yeah. But again, to your point, your first point, having some determination of metrics is a great idea. It's likely to come out of the summit. As I'm sitting here, I felt like, let me just introduce that one piece that had been occupying my mind. So that this is yours, and I certainly appreciate, Mark, the idea that you truly get it and you're okay with the idea that a small victory is a victory.
Right, absolutely, absolutely. All right, any other information? All right, well, thank you, gentlemen, for coming. Doctor, thank you for coming as well, and thank you, council members.
Thank you.
Mayor.